Good day, viewers. It is another fresh edition of Let's Discuss on OSBC TV. Welcome to today's package, which also promises to be revealing and educative. Deaths from resurgence of diphtheria disease across the nations have reportedly risen. This called for great concerns as well as security concerns for individuals to take necessary measures against the deadly disease. We shall be deliberating on diphtheria disease in the country, its resurgence, the prevention, causes, and other related issues. My name is Adebare Ejimakinde, welcoming you on board, and I'm not alone on the program. As you know, I have my co-presenter here, Oluyide, who will be introducing our guest on the program.
All right, you are welcome to Let's Discuss, and as Adebare Ejimakinde rightly put it, today we are discussing diphtheria. My name is Oluchi Amuda. Thank you for joining us. We have a guest in the house, Dr.Oluyide Olumuyiwa. Dr. Oluyide Olumuyiwa is a consultant, public health and community physician, Department of Community Medicine, Uniosun Teaching Hospital, Osogbo. Doctor, you're welcome to the program.
Dr. Oluyide Olumuyiwa, you're welcome on the program.
All right, when we talk about diphtheria, what does it mean?
By the way of definition, diphtheria is a highly infectious disease that is caused by a toxin-producing bacteria. We name it Corynebacteria diphtheria, and it's highly infectious but preventable disease. When it happens, it affects the throat and the nose of the infected person.
Okay, how will you trace the origin of the diphtheria disease? Is it a disease that is typical of Nigeria, Africa only?
No, not really. By the time we trace the origin, it has been in existence for so many years.
Okay.
Even as far back as the time of Hippocrates. That's around 5th BC. It has been in existence since that. But by the time we introduced vaccines, the incidence rate has been coming down gradually. In fact, from million cases worldwide, so less than 10,000 now. So it has been in existence for so many years, but over the years, we are winning gradually.
Winning gradually because of the introduction of vaccines.
Yes.
So what are the causes?
Yeah, like I said, it's caused by a toxin-producing bacteria. Okay. I've mentioned the name, but I don't want to bother our viewers at home. It's a technical name, but let me mention it. We call it Corynebacterium diphtheria, that affects, whenever it happens, affect the throat and the nose. And what we will see, we'll talk about it during the course of this session.
Go ahead.
There's some things, symptoms. Thank you so much. An infected person will come with fever.
Okay.
Infected person will come with cough, catarrh. We come with pain while swallowing, general body weakness. Those are those things that the person will firstly see. Then after some days, you will now notice a thick membrane at the throat, grayish, whitish membrane at the throat. That one will cause, will block the respiratory part organ, and it may lead to difficulty in breathing. And if care is not taken on time, it can lead to death.
That thick membrane, is it at the lower or upper or sideways? Or
just say the upper part of the throat.
Okay, how can it be detected?
The person will notice after he or she must have seen those symptoms of fever, cough, catarrh, that we normally call upper respiratory tract infection.
Okay.
The person will now notice that adherent thick membrane. Adherent means that is actually attached to the upper part of the throat, and any attempt to forcibly remove it may lead to bleeding. So it's just attached to it. I want to know that I'm having diphtheria, or this person is having diphtheria. Okay,
now apart from the throat now, is there any other physical thing that can show in the body?
Then we can mention that apart from the throat that can affect or it can also affect our skin.
Okay.
But it's much more common on the throat and the nose.
So how does it affect the skin? How does it show?
When we have something like ulcer, So the oxygen that causes that of the throat is quite different from the oxygen that causes that of the skin.
Okay.
But that does not feel like ulcer on the skin. So by the time and the symptoms of fever and other things, with probably good diagnosis, what we make this is diphtheria.
That ulcer on the skin, is it pus or holes or what?
Yeah, it comes in stages. It can come from having pus,
Okay.
fluid, it can come to pus to pus, then it will burst. In those stages, before it's now to that fresh wound ulcer.
Okay, now is it possible for one to have the symptoms of the skin without having the symptoms?
If also have the symptoms of the skin,
Yes.
without of the throat, it's
Yes.
possible.
Okay.
To say that way. But it's much more common in that of the throat and nose than that of the skin. But most cases that we used to see is of the throat and nose.
Than that of the skin.
Yeah, that's
And when you say it's highly infectious, how
Yes.
can it? Why is it highly infectious?
It's high infection in the sense that it can easily spread from one person to the other.
Okay.
Just remember the case of COVID,
Okay.
Exactly.
how deadly, how infectious COVID was then. Same thing applies. Through sneezing, when I cough and I don't do my normal cough etiquette, when I sneeze, I don't do my normal sneeze etiquette, I can easily spread from the droplets in that cough. You can, this person close to me can have it easily. Because the droplets flow through the hair and everybody breathes in at one point or the other. So one can still get it.
So it is also associated with the hairborne disease.
Something like that.
You can
Yeah.
categorize it on that. Okay, still talking about how the disease can be detected. Can laboratory tests be of help?
Sure.
How do we undergo
Yes,
such
before we
process?
make mention of that laboratory test, we need to tell our viewers at home that laboratory test is not the first thing for them.
Okay.
Just tell them how it applies here.
Okay.
You know, most people when they go to the hospital, they say, I want to do test. Test is the first thing. Well, if you have money to pay for the test, they have money to pay for the drugs or for the doctor, management. So the first thing, when you have these symptoms that I've mentioned, symptoms of fever, of cough, of catarrh, of pain while swallowing, or general body weakness, Sama, I advise you to go to the hospital.
Okay.
It's not the best time to go to the chemist shop and begin to go and buy a capo or shajo, as the case may be. Go to a government hospital close to you. They have been trained on how to identify diphtheria, and they will give you the treatment and the line of management as the case may be.
Okay. Because the symptoms you mentioned, apart from the one that having to do with the sore throat, it's also related to, you know, when you have such symptoms, you want to feel like you're having malaria. So, if the sore throat is not there, would it now be able to, we won't be able to say, okay, it cannot be malaria?
Now that's
Because if it's coming with the
Yes.
bone of the skin.
another challenge we have in this environment, everything in Nigeria is malaria. That's the problem we have in this country or this part of the world. Everything in Nigeria, everything in our body, even headache is malaria. It may be hypertension.
Okay.
If you have, yes, maybe hypertension, headache, here comes hypertension. But if you have malaria, that's why I'm having malaria. That's why I said, when someone has these 4 or 5 things I've mentioned, and we are in the season of diphtheria, we are in the outbreak time, don't assume that it is what? It is malaria. Go to the right person, that's a hospital, that will make the right diagnosis at that time. They will check and they will do the test. And let me quickly tell you that the test is not where you can do it anywhere.
Okay.
You cannot test, you cannot do inside lab, in the street, and a laboratory beside the street.
Okay.
In the whole of Osogbo State, I'm not sure there's any government lab that can do it. We have specific lab in this state where we take our samples to.
Okay.
So it's not what anybody can just do and say, bring your throat, bring your blood, let me check now. We have just one lab here in Osogbo State that we have designated to do it. We have people that will come and collect the sample. It's not just the sample they can just collect anyhow. The person has to be trained, well trained, before they can collect the sample, package it very well, because it's highly infectious. So sample they can just take one bottle, read it around, pack it very well, and take it to a particular lab here in Osogbo State, sponsored by the state government, to confirm if it's diphtheria or not.
Okay, you were talking about the signs which people come, if they detect it, they should go and report their state of health to the physicians in the hospital. Is it when they see all those signs, or 2 out of all those signs, or whatever?
Yeah, thank you so much. It's not completely that once you have all the signs, but when you are sick to you know that you are sick.
Okay.
You know.
At least
I think we have a very good system in this country, like health insurance that everybody is enjoying. Do you know that they don't your money every month? If you have any one or two, you like to go to the hospital and enjoy your money. But yeah, because you know that when you get to the hospital, you need to pay out of pocket. You prefer to go to where you can get lesser fee for the service. So once you have 1 or 2 of these things, please go to the nearest hospital where they will counsel you.
Now, is there a particular season where you have high rate of diphtheria infection?
Yes. I can say yes or no, but you know what we have been noticing these days is not strictly in that way to particular season.
Okay.
So like in Osogbo State, last December we had an outbreak. This is July now. We're having another outbreak. Since last month. So I cannot say specifically.
Okay, because if you look at that December time, it was Hamatan season, it was cold, and now it's rainy season. So that's why I'm asking if that's actually a thing.
It's maybe related to that coldness of the season.
Okay, who are susceptible? I mean, who are vulnerable to this disease? And what age limits are saved from the disease?
Let me start from the second question.
Okay.
It can affect any age group.
Okay.
Can affect any age group. People that were not vaccinated, that did not receive full vaccination when they were born. Because there's I told you at the early part of the class, it's preventable disease.
Okay.
So when we are born, there are some vaccines that we are supposed to take them at birth, at 6 weeks, at 10 weeks, at 14 weeks, so like that now. Okay. So this diphtheria has been designed, or diphtheria vaccine has been put into our immunization schedule at 6 weeks, 10 weeks, and 14 weeks. So the outbreak we are having now may be due to some mothers that refuse to fully immunize their children.
I wanted to ask that, why are we having a resurgence of that?
Yes, it may be because that's one of the major reasons. It has been proved that we have, because it's common among the children. So most mothers that refused, when government is ringing the bell of vaccination, some mother come out, some mother will still keep their child in the room. I've seen this several times. They keep their child in the room. They will not take the vaccine. They believe that it's not safe. All this postulation, all these theories, all this story of COVID now. I'm very sure that, do you have the COVID vaccine with you?
Yes, we're giving it.
You do? Yes. There are some people at home that they don't take it. Yeah. So this problem of fear about vaccine is actually preventing some mothers. So, and that's why we're having the occurrence of these things yearly. And that's why government will always advise the mothers. And they are spending a lot of millions on this vaccine. And it's free and safe. So that's one of the first reasons why we're having this resurgence. Then overcrowding. In a room that's supposed to stay for like 2 or 3 people, we're having like 9, 10. And I told us that it had the infectious through droplets, contaminated, communicable disease, because it will spread around. Person with immunocompromised, that the immunity is low, can easily have this disease. So those are 3 major group of people that are susceptible to this disease.
All right, thank you very much, Dr. Olumuyiwa. Now let's look at the place of diet in building resistance to diseases.
God bless you. That is for every disease, for us, for all good. When you eat, it's garbage in, garbage out. If you eat good meal, balanced diet, one, immunity will be high. One will not be able to be prone to all these diseases that can easily get to the system with poor diet. So we also advise that our children should be well exposed to good and balanced diet. So diet, in my own perspective, if a child is not is malnourished, definitely can be prone, not only diphtheria though, to other form of diseases.
All right. Let me quickly add this. Let's look at the place of the economic factor now.
Okay.
And the purchase or preparation of balanced diet or balanced meal for the family. You know, a lot of things are happening these days. People hardly get, to eat the 3 square meals, in quote, per day. So how do you want, how can you actually put this side by side?
Let me take it from this side, sir. Balanced diet is not only when you have money that you take balanced diet.
Okay.
You may be poor, you may not have much money and be taking balanced diet.
Okay.
You see children after the rain moving around the broken walls, the blocks, looking for snails. They are not the one eating that snail, so their mother will collect from them and go and sell it somewhere. That snail is supposed to be what they will eat. But because of the mentality, because of the taboo or something, because of culture, the mother will not give it to them. They will prefer to go and sell it, use the money to do another thing entirely. So it's about telling our people that it's not only when you have the money that creates balanced diet. When you have good mentality, what it takes, tell them what balanced diet is, how they can source for it locally.
Okay.
One will not have problem.
Okay. So
Perhaps they don't know the value they can realize from that.
From that state, they don't. You see them herding bushmeat along this road. I wonder.
What do you think that would have given them? Is there
protein. Good form of protein. Good form of protein. Good form of protein. So much because they don't know. That's the essence of media campaign too. It lets them know that it's not everything that you pick that you sell. Eat it for yourself. You may not have money to buy rice, but you can have money to buy beans. Although in the market now they all know the same thing anyway. But locally you can mix 1 or 2 things together and you get a balanced diet from it.
Okay. What are the ways of preventing the spread of the disease?
Now, the first is vaccine. All mothers must ensure that your child from 0 to 5 years take our routine immunization vaccine. The government of the day is spending a lot of money on it to afford this kind of embarrassment. We should encourage our mothers at home, our parents, fathers and mothers. I've seen cases where it's the father will give instruction that nobody should give my baby this jab. So we should encourage the parents at home that please ensure that your children between 0 and 5 are exposed to this.
What are the importance of getting that immunizations, and where can they get
Sure, if you are fully immunized, let me give you this scenario. If you are 100 people in this room, and 90 of us, well, even 85 of us are fully immunized against diphtheria. Diphtheria will not come to this community.
Okay.
We call it herd immunity, community immunity. If 90 of us out of 100, but in case we have just 40 fully immunized, maybe 50 will cost people for us now. So that's why we always shout at the time the government is taking this vaccine around. Make everybody that's going to take it, take the vaccine.
all right, now that is talking about children. Now for adults, so you said there is no age limit to those that can be infected. Is it possible for adults to still walk into the health centers or health facilities and say, I want a diphtheria?
It may not be possible.
So
it may not be possible. It's not common among the adults. That's I've told you at the end of this discussion. It's very common among children. Those cases that we have seen so far are the children.
All right. You said the diphtheria is a bacterial disease. Now, tell us the difference between a bacteria and a virus.
Wow, bacteria and viruses. How will I explain? Okay, it's just a matter of names and the kind of action they do in the body.
Okay.
My name is Olumuyiwa. Your name is Oluchi. Oluchi. So, the kind of role I will perform in the house come from the role you will perform.
Okay.
The kind of what you use to stop me, our stress ability is quite different from each other. So when something is bacteria, we call the kind of action to produce bacteria. So for the benefit of public who are not scientific, let's go to that.
So which one is Dagelan?
That means both of them.
Okay.
Both of them. COVID is a viral disease, so I hope you still remember.
Yeah, exactly.
And it depends on the level of immunity of the individual at that point in time. But both of them.
Okay,
are killers.
Is diphtheria a curable disease?
Sure. There's somebody come with those things I've mentioned. I've mentioned of fever, I've mentioned of cough, I've mentioned of catarrh, I've mentioned of pain while swallowing, general body weakness. Come to the hospital. When you come to the hospital, the medical team will see the person and they will make the rightful diagnosis. And they will give you treatment. We have treatment. Don't let me mention the treatment. If I mention it now, you will start going to the chemist and buy it. So that when we need the drugs, we will not fight it again. So come to the hospital, I can assure you that if you go to any health center, any primary center, secondary center, that's general hospital, come to Uniosun Teaching Hospital here, you meet good hands that will make diagnosis and give you treatment as the case may be.
What is the chance of surviving the incident?
If you come on time.
They should come on time. Adequate facilities for that?
Sure. If you come on time, the problem we have in this part of the world is that we don't come to the hospital on time. We don't. That's not our fault because of the money. Like I said, if you know that this place I'm going is free of charge, you will go there. But you know that with this year I'm going to spend money. I not even got money to eat. You will still be finding alternatives. And those something will not work. So at the end of the day, it will come to late presentation. But if you come on time, you have treatment for it.
Okay. Now, you talked about the fact that people hardly go to the hospitals.
Yeah.
And these days, you just get to hear that somebody is slumped and dies. What is actually the cause of this?
My sister, I used to tell people as a public health physician, adequate, prompt medical checkup. If I'm privileged to be in a position now to advise government, I will still advise that there's nothing good as health insurance. That's what UK is spending the money on, seriously. US, they know the importance of prevention that is better than cure.
Okay.
So, if you go to hospital at a regular time, they check your BP, they know that you're hypertensive, they do other tests to confirm if that's affected some organs or not, and they give you drugs. There won't be any slump, there won't be any untimely death, because it has been prevented. But because, you see people with BP of 180, 130, they still be walking around the street, jumping up and down. You just hear snore. You would think that it's Ogundide somewhere. Majority of them, they are not. Permit me to say this, sir. If you can have this attitude of prevention, not to only diphtheria, to either communicable and not communicable diseases. If you have this attitude of health-seeking behavior on time, this kind of thing will reduce drastically. The problem we have here is that our attitude here is very poor and related to many factors. I've mentioned that of money. Majority of people that visit our hospital today, they take the money from their pocket. And the current situation of the country, you cannot be able to do such. So you still be looking for agbo, looking for iwe, looking for a way, I remember very well during this jamboree that our governor did a few months ago. We were in a town, and I overheard those women say, we thank our governor, at least we will stop taking the Wuru for now. That will touch my mind. So that's why they have been taking the Wuru to treat diabetes. And that one will not work. But we give them drugs, and this will prolong their life. And if we repeat it another few months, they will be enjoying it. Imagine that kind of woman is enjoying health insurance scheme. Who is? As the case may be. If we have access to his doctor 24/7. So if we have, he or she will not have complication of diabetes. He or she will not have complication of hypertension. If you have long life to live.
Okay, now let's look at the issue of alternative medicine. This herbal medicine, some are being approved by NAFDAC. Is there any issue with that?
Besides speaking, the NAFDAC will tell you that they only tested for the safety. Check it very well.
Okay.
That's what NAFDAC does now. Safety, not the pharmacokinetic or pharmacodynamics of the drugs. That's what NAFDAC does. They only check for safety. So I will not be here to discuss them, but sincerely speaking, we can still do better. We can still do better about alternative medicine. We can still do better.
Okay.
We are working, but we can still do better.
All right. Thank you. I met someone, another person, during the COVID-19 vaccinations period. He was telling me that he is afraid of getting that jab of immunization that he has never, except when he was a day young. So how effective and adequate are diphtheria vaccines?
The vaccine, I did a study at one of these institutions at Ekiti State in Ekiti about vaccine hesitancy, and it was revealed that many of the students have not taken the vaccine, and they told me why, and it was conformed with what we have read in the journals. But we can still do something about it. All vaccines are safe. No, before government can allow you to give a citizen, a dear citizen vaccine, you will have tested it somewhere, passing through all the phases of clinical trial. That's what we call clinical trials. Okay. And that's different between Western medicine and alternative medicine that we are talking about. I don't want to go to that place. But that's what we call clinical trials, about 4 or 5 stages. Before we can give vaccine to anybody, that vaccine will have passed through that stages. So I can assure our mothers at home that our diphtheria vaccine is safe. I cannot kill your baby. So anytime you have the baby, take the baby to the hospital. At 6 weeks, the vaccine has been put together with some vaccine. We call it pentavalent vaccine now, 5 in 1.
Okay.
And you give to your baby at the leg or at the thigh at 6 weeks, at 10 weeks, and 14 weeks, so that you will not be causing outbreak for us in the next few years.
All right, thank you very much, Dr. Olumuyiwa. Now, if you just joined us, it is still Let's Discuss, and we'll be discussing diphtheria with Dr. Oluyide Olumuyiwa. Now, let's look at the general state of
prevention.
Okay, yes, we'll still get to that.
Okay.
Look at the general state of the health sector in Nigeria. You know, when COVID came, the pandemic took everyone unaware, because obviously public hospitals in Nigeria were not really prepared. People started running health care and government and the rest. Now, if there should be another pandemic now, today in Nigeria, God forbid, but how prepared are we?
So, speaking, COVID-19 have taught us so many lessons about emergency preparedness, emergency management, disaster management. As a country, I think we have learned some lessons.
Okay.
And that's one of the things that COVID-19 has brought to us. It allowed government to push out to know that health sector we need much more money there. So it has improved the consciousness of the government that look, the health sector is not what we need to play with. Government of the day, they may learn the lesson, but they may not appreciate it.
Okay.
That's the fact. They will tell that we have announced that we should increase our budget to so percentage, but have they actually done that? No. That's the Nigerian mentality. But let's look at that positive that COVID-19 has taught us. It has taught us the essence of be consciously aware that we must be prepared for emergency, we must be prepared for disaster, and be prepared for outbreaks.
Okay.
And in a state like Osogbo State, we have a center that we call Emergency Operation Center, where this kind of emergency preparedness and emergency management is being discussed. And that the case of the diphtheria now, when the issue reoccurred about a few weeks ago, that center was reactivated again. Okay. And there we have groups of experts in public health space that will discuss issues together, discuss diphtheria, and they will advise the government of the day. Okay. And they have been doing it. And that's why you can see that issue is getting down or going down gradually. Right. So they are doing their job at that level to ensure that we don't have the continuous spread of diphtheria.
Okay, well, I actually asked the question is the fact that you say there is this brain drain issue that is attacking the health sector. A lot of doctors, have moved out of the country, and there are some that believe that most of the public hospitals we have now are more or less like death trap. That when you get there, you find it difficult to get a doctor to attend to you. And these ones that are going out, moving out of Nigeria, we always tell you that they do not have enough facility to work with. So that was what I asked, if our public health facilities are ready for emergency.
So, sir, speaking, we are not ready. That's the truth of the matter. And you know our leaders, on a day they will travel out. And maybe we can have a law that will say everybody must be treated in Nigeria. The senator will have a day and will come to a specialist hospital. When you see what is going on there, you like to make a law in Abuja that will strengthen that place. You'll be the one that will advise the power that be that let's increase our budget from 3 point something to 25%. I wish we could have such a law. To speaking, most of our hospitals, they are nothing to run about. You go to some hospital at night, there won't be light. The generator will not be functioning. We've seen cases we do operation with torchlight. We see it on social media around us. There's nothing need to be hiding. But be as it can be, in some state like Osun, the government is trying its best to improve the state of our health facility. To be fair to him, is doing everything possible to improve the condition. And he have good hands at hand that are counseling him on how to do this, how to do this, how to do this. So that the indigent of our state will know that they have access to free, good and good treatment as case may be.
Okay. What's the development on the incident cases recorded in Osun? Is it improving? And what are the government interventions?
Yeah, like I said, the government is doing its best to curtail the spread of that disease.
Okay. Through
the action of the EOC members that are advising our governor, and governor is yielding to their advice, that technical advice.
Okay.
Because they have to give strategic advice to the governor, and is doing that to make sure that we can see the result, that we don't have the spread again.
Okay.
It has been halted, and thank to Mr. Governor for yielding the advice to those technical teams that are working against the diphtheria outbreak in the state.
All right. How can the diphtheria disease be prevented?
Thank you so much, Madam Oluchi.
Oluchi.
Yes. In public health space, when we are talking of prevention, we have primary prevention, secondary and tertiary prevention. I will hammer more on primary prevention.
Okay.
But that's what matters to people listening or hearing me at home. No primary prevention, you may have what we call health promotion.
Okay.
Like health education that we are doing now.
Oh, right.
Like environmental cleaning of environment. Like behavioral change, lifestyle behavioral change. Like telling people that vaccine is safe and will not kill anybody. So that's under health promotion, and that's what we are doing for you now. It's a pity that now we have a lot of information flying around on social media that may not be saying the right thing. That's one of the problems we have with COVID-19. That many people did not take the vaccine. But please listen to the expert. Enter they are telling you of a particular disease. So I'm here to tell you that health education, we need to let you know that's what we have been doing so far. Still under primary prevention, we have specific protection, like the issue of the vaccine, and we have been telling you that the DPT vaccine or pentavalent vaccine is safe. So all mothers, take your children for that vaccine. When your child is 6 weeks, ensure that he has the pentavalent. When it's 10 weeks, ensure that the baby has a pentavalent vaccine, and 14 weeks. So that's the specific protection. Cough etiquette is part of it. When you cough, you try to protect the person beside you not to catch, and you don't not spread. If at all you have it, sneezing etiquette is part of it. Isolating the infected person is part of the primary prevention. So those are those things that our viewers at home need to know about the primary prevention. The second prevention is when you come to the hospital, prompt diagnosis and treatment. That one is for us.
Okay.
And we are ready to do that one for you. When you come, and please come on time. It's not all cough, it's not all fever that is malaria. So it's not all general body weakness. That's malaria. Once you have this, please come to bring that child to the hospital. Don't do self-treatment at home. Stop taking all these herbs, bring him or her, and we have experts. In fact, there's an algorithm that the EOC has designed for all the hospitals in Uniosun State that they will follow the treatment of this diphtheria. Like I said, it's not, you can't do the test everywhere. So when you present the case so early and at any time, you have the flow chart that's been given to all of these health centers or hospitals that they will follow in the management of this diphtheria. So leave primary, I've told you what primary is. So leave secondary for us. Tertiary is to prevent disability and the likes. Leave that one to us. But I'll focus more on this of primary prevention.
All right. Does it lead to disability?
Oh, sure.
Okay.
Sure. It affects heart. Diphtheria is deadly. It can affect heart too. It can affect kidneys. It's deadly. That's why highly infectious, serious infection. It's called otitis media, and it can lead to death. So what that population do once again? That's why the case fatality rate, the number of death from this disease is high, because it's highly deadly. Anything that blocks the respiratory tract, it's highly deadly.
How long will the disease be in the body before?
Yeah, because that one incubation period, it's around 1 to 5 days. Incubation period means time the infection get to the system and time it begin to show signs and symptoms. 2 to 5 days. But it can be in the system if you are not taking drugs for like up to 6 weeks. And that one can lead to those complications that we have just mentioned. I say it's highly deadly, and it's better that one increases health-seeking behavior. Have good attitude to that one. So you have anything like this, please call your doctor. Go and see him.
What are the advice ways of getting the immunization?
There's nothing like advice of immunization myself.
Okay.
The children we are giving it to, the only thing they can have is pain at sight.
Okay.
We have it at 6, 10, 14.
Okay.
Waiting the little child know. They said to cry. Have you? It's not we adult that we're running after. The children is said to cry now. So we give, and I want to tell you that vaccines are given by well-trained personnel. It's not Osogbo matter.
Okay.
They choose the CHOs, the public health nurses. They are well trained. Went to good school, have certificate. So little pain at side, swelling at side should not be the one that will deprive you from killing your baby later.
All right.
Can body immunity have a place to do with this diphtheria disease, in preventing the diphtheria disease?
If you're good, but that's why I said
it help to checkmate it.
Yeah, if you have the diphtheria vaccine, it will increase your body immunity to check it to prevent it from occurring.
All right. All right.
Don't forget, I said many years ago,
Okay.
we used to have more than a million cases.
Okay.
But now with the introduction of this vaccine, it has dropped down and it can be halted totally if everybody.
Okay, how can body immunity be enhanced?
For which particular disease?
Maybe for various diseases, especially like diphtheria. Because
Diphtheria.
body immunity is very important.
Like we talk of diet now.
Yes.
You can improve that immunity.
Okay.
Diet, like I said, to improve that immunity. But most important thing for diphtheria is please let your child have the jab.
All right. Let's look at the general well-being now. What are the lifestyle changes you think members of the public can actually imbibe to promote good health?
At this time of our country is somewhat difficult, sincerely speaking, but we still need to encourage ourselves. That many years ago it was much more difficult than this. Because remember when I was growing up, there was a time, don't mention the name of that head of government, that we were using sawdust to cook.
Yes.
So I'm not going to that down for now. So tell yourself that I will tell you about Jessino, no ma shikini, no ma before. I get that thing now.
Yes.
When you bad J, no ma before. Try have good attitude to your health. This is not the time to be buying clothes around. Clothes that you cannot wear within 4 months is not your clothes. That is what I used to tell my people. Eat good food. Have good attitude to yourself. If one has good skin, good immunity, disease will run away. Good environment, clean environment, disease will run away. So behavioral lifestyle change is very important. I'm going to tell ourselves the truth at this point in time. It's going to be okay. By God's grace, everything will be all right very soon. But you have to live to tell the story at that time.
Okay, let's look at the brain drain in the health sectors. What are the factors responsible to that? What is the situation of things and the health institutions and the way forward?
Oh, some multifactorial, sir. From the issue of wages to the issue of hospital equipment to the issue of number of hours we are working, they are multifactorial. And that's what our doctors are seeing, and they are buying to that side. So we always advise our government, do the needful. Most of the equipment we have in the hospital, they are old. Sincerely speaking, go to some of our hospitals. We will still be seeing 2D ultrasound. We still be seeing ultrasound of 2001, 2020, and this is 2023.
Some of them are old because a new set have just been purchased.
So, and the government is not pumping money to the health sector. And as I've said, it's because they don't want to, they know they are not enjoying it. So, if they can fit, as we are talking now, the resident doctors around the country, they are on strike. And they have reasons why they are on strike. So, can we face this health once and for all? can we face it once and for all? Let's just face once and for all. If that's what we want to enjoy the next 4 years, I'm ready to do it. Can you pump enough money to this sector? It will stop. Like those young doctors we have now, many of them are not ready to wait. You'll be teaching them in hospital, world round, they'll be reading foreign exams. That's in your presence. Right in your presence. You'll be talking like this, they will not be this, they'll be really prepared for foreign exams. Because they know that there's no hope in this country for now. But if government can just do something better, that'll be hope.
Alright, let's look at the issue of doctors going on strike. Doctors are actually meant to save lives, protect lives. So how does it feel when a medical doctor says somebody that is so sick and he said, no, I'm not going to touch you, I'm on strike? My
sister is so pathetic. But can you also pity a doctor that don't collect salary for like 6 months? I don't read doctor, we make mistakes. I have junior colleagues in one of the federal teaching hospitals in this southwest that's working for like 6 months. I'm not mentioning the name of the hospital. And I'm not collecting a month's salary. And you're working, you want that doctor to treat you? You know that doctor is not even safe at that point in time. You have to take care of yourself first. We are human beings. We are not gods. We need to take care of ourselves. We need to take care of myself, of my family, of my parents that spend a lot of money for me to finish medical school. And I'm working, you are not paying me. For 6 good months. But it's not even safe for that patient to be in front of that doctor. So, take care of the doctors. Give them what they want. They are not crazy. They know the right thing to do. So, please, don't blame them. Blame the government. Blame the employer that they are not doing the right thing at the right time.
Alright, because of our time that is fast spent, shortly, what's your advice to checkmating the outbreak of this diphtheria? How are you taking these messages to the churches, to the schools where we have children in order to curtail the spread of this disease? Shortly.
Thank you so much, Demontri, once again. The people at home will still continue to appeal to us because to advocate that health is wealth and prevention is better than cure. This issue of the diphtheria is a preventable disease and it's prevented by the vaccine. So don't wait until your child has this disease. Follow the government guidelines, agree with us, take the vaccine at the appropriate age, and that child will take you to Canada. That child will take you abroad. That child will take care of you when you are getting to your older age. So please, it's not a good thing for a mother to lose a child. It's not a good thing for diphtheria. It doesn't make sense. So please don't hide your child. Don't keep him or her somewhere. Take that vaccines. I shall be well with him.
Alright, your advice for the adults too is always working and that they have time for.
Adults, please have time for medical checkup. Prevention is better than cure. Don't wait until your heart begins to do like this. Pump, 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 pump. Don't wait until the kidneys are no more functioning well. You have them, go to teaching hospital. You see people with renal failure. And I want to advise us, be sure what you are taking into your body. Let us be sure of that drug that you are taking. Let us be sure of that concussion you are taking. Let us be sure of that agbo you are taking. Go to a very good hospital. We have them all around there in Osogbo State. Government, the present governor is doing his best. Please, let's enjoy this thing together. And we will enjoy our health at the end of the day.
Thank you very much. We did it right at this juncture to wrap up today's presentation. Special thanks to viewers for making the day with us. And our appreciation also goes to our guest.
Thank you.
Dr. Oluyide Olumuyiwa.
God bless you, sir.
Thank you for coming on the
Yes,
program.
Dr. Olumuyiwa is a consultant public health and community physician, Department of Community Medicine, Uniosun Teaching Hospital, Osogbo.
Thank you, ma'am.
Thank you very much.
Thank you for coming on the program.
Thank you, sir. God bless you.
Yes, and this is where we are saying our bye on today's edition of
Yes,
Let's
bye-bye.
Discuss.
Do-
Join us next week for another edition of the program. My name is Oluchi Amuda.
Do have a blessed new week. I am at Disphteria.
Bye.
Bye.